So here we have our first responder kit. So in the front upper pocket we have everything for vitals, such as pediatric and adult BP cuffs, a BGL set, stethoscope, thermometer, and some shears, as well as a pupil torch. Moving down from that one, in the lower one we have mainly all of our PPE, some extra fluids, glasses, masks, and a pad. On the side upper pocket we have some sick bags, a spinal lanyard, as well as some spray anesthetic. Moving down to the one next to that one, we have everything for glucose management. So we have some glucagon, we have a syringe, we have a saline glucose mix, as well as some oral glucose. Moving around to the large side pocket, we have everything for bleeding management. So we have tourniquets, different sizes and shaped bandages, some saline, some gauze, tape, and anything else you may need. Going into the main pocket, on the upper end up here we have all the medications such as Panadol, ibuprofen, tramadol, aspirin, anything you really need, as well as a Penthrox inhaler, also known as the green whistle. Moving one down from that, we have OPAs, NPAs, a laryngoscope and forceps, lube, and biohazard bag. The next one down is salbutamol and adrenaline, and oxygen mask as well, a nebulizer mask and oxygen tubing. We also need to ensure that all medication is before the expiry date and that there is a minimum of 10 adrenaline. Moving on into the big bag, we have a towel, a neck brace, some splints, a shots container, some slippery sand, some IV lines, a saline bag, an IV giving set. We also have an LMA kit, an adult and pediatric bag valve mask. So here we have the suction unit. So the first thing I'm going to do is turn it on, and I can see that the batteries are charged by the lights turning on. The next thing I'm going to do is unwind it and occlude the tube. When I occlude the tube, I should be able to see the lights rise, indicating that there is suction, which I can also tell when I release it, I can hear it. So the next thing I'm going to do is check that the rigid catheter is sucking. So to do that, I'm just going to put my finger on the hole and just press it against my hand, and I can see and hear that it is working. So the next thing I'm going to do is apply it to a patient who should be in the recovery position in case vomiting has occurred, in which gravity can assist. So what I'm going to do is, making sure my finger is off the hole, I'm going to go in just as far as I can see, put my finger on the hole, and in circular motions come out, making sure not to stay in for any more than 10 seconds. So with these rigid catheters, we have to be careful as they can cause oral trauma, as well as induce any more vomiting, and in some cases hypoxia. We also have a soft catheter, which we can use in the ambulances, kids and in the nose, as we cannot use these rigid catheters in the ambulances themselves. So now I'm going to talk about oxygen delivery. So the first thing you do is you identify the oxygen cylinder by seeing that it is a white bottle with a black dial on the top. It will also have a label on the top saying whether it is oxygen, medical air, or compressed air. This one is for demonstration purposes, so it is compressed air, however this bottle is empty. So the next thing I'm going to do is check the regulator, which looks like this, and inside of it is the Botox seal. So what you're going to do is you're going to take that off with your nail, have a look if it's adequate, so it has no tears. If it has no tears, you can put it back on, and then you can apply the regulator. If it does have any tears, you would hear a hissing sound when you try and turn on the oxygen. So what you're going to do is align the prongs that are on the regulator with the prongs that are on the bottle, put that down in there, and make sure it's nice and tight. Once you've done that, you're going to turn the right dial on, and you'll be able to see the needle on the dial on the PSI gauge rise, and it should be in that green section there. If it is not in that green section, or if it is a quarter of the way empty, you should refill it or get another bottle. So the next thing you do is you would test it to check the flow rates. Like I said, this one is empty, so you can't hear anything, but you'll generally hear if it's on. So you would lie it down for safety purposes when in use, for example when you're using a mask. So in this demonstration, I'm using a bag valve mask, which I'll attach by pulling it all out and then attaching the oxygen tubing to the nozzle on the end of the bottle. When using a bag valve mask, you would set it to a flow rate of 15 litres per minute or more. When you're using other masks, such as a nebulizer, you would set it to 7 to 8. So to change the flow rate, you would just turn this dial up here, to, for example, 15. You would use oxygen on a patient if their oxygen saturation levels were below 94%. So when you are trying to put away the oxygen, you would first and foremost turn the flow rate off, detach the mask, then you would turn the top dial all the way off, bleed out the rest of the oxygen, which you would hear, turn it all the way back off, then unscrew the regulator. You can then release that, take it off and lie it down. You would find these attached to the side of the ambulance. So here we have the Lifepak 12 defibrillator, in which you would find on the ambulance. So turning it on, you just press the on button and then it should all light up. So the default is AED mode, but I'm going to put it in electrodes. I'm just going to put it in manual mode by clicking advisory and going yes. So after that, I'm going to do a user test by clicking options down to user test, just to make sure that all the functions are running properly. So while it's doing that, I'm just going to go through all the pockets. So the pocket closest to me is everything we need for our diagnostic. So up in here, we have our end-tidal CO2, which measures our expired CO2. We have our adult blood pressure cuff, which we can activate by pressing the NIBP. We have our SpO2, which measures our oxygen saturation levels. And we also have our 3-lead, which actually has 4 cables. I'm just going to get that out as I'll be attaching it a bit later. In the pocket over here, we have everything we need for our AED defibrillator side. So we have our test load, which we'll be using a wee bit later. We have our defib pads, or in this case nodes, as we'll be using a mannequin, which attaches to this cord right here. We have our G10, our razor, and some aspirin as well. And in this pocket, you could also find some spare printer paper, if available. If not, it could be in a back pocket, which this Lifepak does not have. Turning it around, you would check the batteries by just clicking these grey buttons up here, which I can see that they're both full. However, if they're empty, I would just pull it off to the side and I can change it that way. So I'm just going to flip that back around. And the user test is finished. So now that the user test is finished, I'm just going to have a look, see that it's passed, which it has, and then I'm just going to pop that to one side. Another thing that we also need to check is that there is printer paper, which you can do by just lifting up this tab, pulling it out, having a look, and then you can remove it and change it out by just pulling it out there, and then just popping it back into place. So the next thing I'm going to do is set up a test shock. So to do that, I'm just going to grab my defib cord and my test load. Just going to plug that in right there, and then I'm going to click charge. And then press shock. Shock delivered. However, if I wanted to shock someone, but then I wanted to cancel that shock, you just click the selector knob, which is just down there. So the next thing I'm going to do is just change from the shock load, and I'm just going to attach the defib cords, or nodes in our case. Just going to plug that in there. And then unfortunately our mannequin over here does not have any metal nodes for these to attach to, but I will just demonstrate it anyway. So it goes up here by the chest, and then another one down here by the ribs. So what you can also attach is the 3-lead, which I set up for myself a wee bit earlier. So I'm just going to attach them like so on the body. As I'm using a mannequin, nothing will show up on the defibrillator. However, I'll still show you how to change the look of the ECG. So if I wanted to change to the different leads, so in this case a 3-lead, I'll click the button lead, go down to where it says 2, 1, 3, click that one, and we're on 3-lead. To change the size, you just click the size button and then go down to your preferred one, such as 1.5. Then what else you can change is the sound of the heart rate, or the QRS volume. So you just go up to that one there using the selector knob, click the QRS, and then change the volume to whatever one you prefer. And then after that, if you feel like you have to go back into AED mode, you just click advisory and then analyze. And then it should come back up with AED mode. And that is how you use a Lifepak. So we've arrived on scene to a 65-year-old man. He looks quite pale and doesn't seem to be breathing. Around me, I cannot see any visible hazards. I've parked the stretcher outside for an ease of access. Matey, this looks like it could be a resus, so can I please get you to set up the AED and the suction unit for me, please? Hi sir, my name is Holly and this is Matey. We're from the ambulance. Can you hear me? Can you hear me, sir? No response to verbal. I'm gonna try pain. Sir, can you hear me? Hi sir. No response to pain either. I'm just gonna use a head tilt chin lift and look at his airways, which seem to be clear. And now I'm just gonna look, listen and feel for his breathing for 10 seconds. Alright, Maddie, he doesn't seem to be breathing. Can you please start CPR? Now I'm just going to turn on the AED and call for backup.
Low
AED to comms requesting an R50 backup.
Analyzing heart rhythm. Do not touch the patient.
Don't touch. While the AED is setting up, I'm now just going to set up
Shock
the bag valve.
advised. Charging. Stay clear of patient.
Everybody clear?
Deliver shock now. Press shock delivered.
Start CPR when it's
Pause. Start CPR.
So now I'm just going to set up an OPA and an NPA. To measure an OPA, you're just going to go from the corner of the mouth to the corner of the jaw, inserting it upside down, rotating 180 degrees, and it should slot right in. You wouldn't use one in the case of trismus or seizing, and it could cause soft tissue damage. And you wouldn't use it when they're conscious, as it could start a gag reflex. I'm now going to just do an NPA, which I'm going to make sure I'm just going to lube up. And I'm just going to measure it from the nose to the earlobe, the nostril to the earlobe. Then I'm going to insert it in the biggest nostril perpendicular to the face. If you get a bit of resistance, don't be afraid to give it a little bit of a rotate and it should slip right in. You wouldn't use it in case of facial fractures or a TBI or fluid in the nose, and it also enhances intracranial pressure. So now I'm just going to turn on the oxygen, making sure it is at a flow rate of 15, as that's what is needed for a bag valve mask. So now I'm just going to use a CE grip with my forefinger and thumb, and using my other 3 fingers to hold up the jaw to maintain a open airway. Maddie, could you please count down your compressions from 5 for me, so I can do the 2 breaths. 5, 4, 3, 2, 1. When I'm doing the breaths, I'm making sure I'm only going 1/3 of the way into the bag and making sure that I've got a good seal. Maintaining a good seal is really important, but facial hair as well as any trauma to the face could cause complications when maintaining that seal. We need to make sure that the reservoir bag is filling up appropriately, as it could cause suffocation to the patient itself. Another way of holding a bag valve mask is the 2-handed grip, which you can hold with your 2 thumbs on the patient's face and using your other fingers to hold up the jaw. However, I prefer a CE grip, as it's easier for me to do the press.
Stop CPR.
Alright, Maddie,
Analyzing heart rhythm.
you're doing really good compressions.
Stay clear of patient.
Alright, Maddie, when I'm doing my compressions, could you please count
Analyzing
to
heart
25
rhythm.
and then
No
35
shock
out
advised.
loud,
Pause.
so I can stop the
If
breaths.
needed, start CPR.
Ma'am, were you in the room when this happened?
Yeah,
Awesome. Does he currently take any medication?
not that I know of, no.
Does he have any current medical conditions?
No.
5, 4, 3, 2, 1. Was there any CPR before his arrival?
No.
Yeah. Okay, thank you. I'm just going to continue doing CPR until backup arrives or until he is revived. Making sure to come 5, 4, 3, 2, 1. Going 1/3 of the way into the chest, making sure to come all the way up. Oh, yep, we're good. Making sure to come all the way back up so the lungs can re-inflate. Awesome, thank you, Eddie.
Stop CPR. Analyzing heart rhythm. Stay clear of patient. Analyze